There we go. So now I could say, welcome to this session, 1 hour in length or less, single session, evidence-informed vaping and marijuana prevention plus wellness program. So this is being recorded. I'll send you the link to this recorded session, which I hope you'll widely share with others in your region and state. And no slides, because there's only a couple of set of slides. Instead, we'll be really looking at the manual. So 4 session objectives today. The first is to explore, explore contents in the Vaping and Marijuana Prevention plus Wellness manuals, of which we have a high school and middle school version. So that's the first thing we'll do. And then we'll also, during that process, I'll be able to compare for you the differences between providing these marijuana and vaping messages for youth individually and in group settings. Now, normally, again, the scripts are designed to be provided face-to-face, but you can provide them by phone. You can provide them live online. And so if you want to discuss that a little bit today, we can, but we have a separate webinar tomorrow, as I said, about 30 minutes in length, just with the providing prevention, and particularly prevention plus wellness programs and evidence-based programs during an epidemic like this novel coronavirus. So we'll talk about distance learning and online options for providing our programs. Third objective for today is to review PowerPoint slides in particular, so that you can see what those slides look like. So you really have the program manual. If you purchase our programs, if you're familiar with them, you get a physical manual. The manual has the scripts for implementing your vaping, marijuana, sport, any of our prevention plus wellness programs. You get that manual in hand. You have the script to provide it one-on-one to youth in person, or as I said, you can also do that by phone or online. And then also in a group setting. So you have those options. You also get a digital download. You copy that download to your device, your computer, save it, keep it, and you have in that download your PowerPoint slides for presenting your program and all your reproducible materials. So it's a one-shot purchase. No need to buy anything else. You can make all the copies of your program materials, your screening surveys, your goal plans, your evaluation tools, and so forth, all in your program manual. And then, of course, we do offer an online 2-hour online training, live online training, which is very, very important. We don't require it, but we highly, highly recommend it because it will walk you through the scripts and let you see them exactly and give you detailed instruction, and also how to tailor the program to your setting and population, and lots of essential content in that 2-hour live training session. So there's the program, manuals, downloads, and then there's the training. By the way, just in case you're interested in cost, the manual is a $4.99 a person, and then the training is $1.99. So one-time cost. That's item 3. And then number 4, identify online program implementation and evaluation support materials. We'll cover that a little bit today as well. So these programs, vaping, marijuana, sport, in shape, most of our programs in God's image, all single session programs. We do have a 6-session sport prevention plus wellness program. But the point I wanted to make was that even though these are single session, we do during the training talk about how you can extend them beyond a single session if you want to, if you have access to young people. But the beauty of them and the advantage of these prevention plus wellness programs is that they're single session, and so you can implement them and really should be able to reach all youth and young adults. So you can have a true public health effect across the board. So unlike other evidence-based and non-evidence-based programs that are multi-session or more complicated in nature, these prevention plus wellness programs are scripted, single session, so you should be able to reach every young person and have that essential prevention communication with them. All right, so those are the objectives. That's what we're going to do at this time. So, but before we do that, let's get to know each other, see what's going on, see who's tuned in today. We have actually a fairly nice sized group. I'm going to stop sharing this. And just so everybody gets used to your tools here, there's a chat option below. I think it's below. And everybody, if you could just find that and then just type in who you are and where you're logging in from today. You can use first name, last name, both, whatever, it doesn't matter, whatever you feel comfortable and where you're coming in from. And then we'll take a look and see who's visiting us today and who's spending time with us. And I just want to thank you for taking time from your busy schedules, which actually may be a little less busy or may be getting more busy with online activities. But thank you for sharing, nonetheless, your time with us. So let's see who's calling in or logging in. I'm going to go back to the very beginning here. We got a lot of people logging in. So we've got Kelvin from the Bronx. Welcome, Kelvin. We have a lot of providers from the Bronx area. And then Kelly from Arkansas, the natural state, beautiful. I lived there for 6 years in Fayetteville, my first academic appointment at the university there. Gorgeous, gorgeous state. Marie from New Jersey, nice to have you with us, Marie. Isaac from Washington State. We have a lot of providers of Prevention Plus Wellness from Washington State. So, and I went to their state prevention conference last year. It was an awesome conference. So hopefully things will die down here with this virus and I'll be able to attend that this year. We have Samantha from Carson City, Nevada. I was there years and years ago. Really cool city. And we have Rashonda from Arkansas. Yay, Arkansas. Tiffany from Williamsport, Tennessee. Beautiful state. Pam from, yes, Community Counseling Center. I'm not sure where that's located. I don't recall right now. But we've got Andy from Seattle, Washington. And my heart goes out to you guys and everyone in Washington, which really have really struggling and dealing with the coronavirus. And I hope you're safe, Andy, and everyone you know in that area, and that you're dealing with this well. And Melissa is from Dover, Tennessee. Sherry, you can see, is from Fort Knox. Eileen, I'm not sure I'm pronouncing that right, but that's from Kent, Ohio. Samantha from Olympia, Washington. Catherine from Lopez Island, Washington. That sounds like a really cool place. Michelina from Pennsylvania. Also, all the states are beautiful. Just put it that way. All great places to live. Elizabeth also from Tennessee, Spring Hill. So we got quite a few people from Tennessee, from Washington, East Coast, all the way to the West Coast. We got Beverly from Washington State. Christy from the Bronx in New York. Russ from city of Quincy in Washington. Brandy from Oklahoma. Yay, we got in Oklahoma. We've got Alexis from Long Island, New York. Carrie from Nashville. That's a really fun city, and I hope you guys are recovering from that horrible tornado you had earlier this year. Sherry from Fort Knox, and that's in Kentucky. So lots and lots. East Coast, West Coast, nobody abroad today, but that's fine. We've got the whole United States being represented here today. All right, so let's go ahead. We'll dive right into it and take a look at the manual. We'll start with the vaping high school manual. I'll start with that one. And so again, what we're going to do is we're going to I'll walk you through the manual so you get a little taste of actually more than a little taste. You'll get a good view, I think, of the of the contents in the manual. We'll look at a PowerPoint slides. We'll look at vaping versus marijuana. We'll look at the high school versus middle school. And so, so you'll get a good sense of what these programs are about. So here's the table of contents, very similar for most of the Prevention Plus Wellness programs. There's 6 sections to them. It looks like some of you were on our webinar yesterday when we talked about the evidence-based sport program, so this looks very familiar to you. There's a section number 1 on introduction. Then there's a section 2 is step-by-step directions for implementation, which we covered during our online training. Section 3, which is the individual script, or the one-on-one script. This is where you could sit down with an individual youth, one-on-one in a private or semi-private setting, and provide this to them individually. It's the tailored approach. It's actually going to be tailored specifically to the screening survey that they complete, which is they identify their healthy habits, physical activity, nutrition, sleep, as well as whether they use e-cigarettes, and you're going to provide feedback about those behaviors specifically to them and how they responded to that screening survey. So the section 3 is that script for the individual, the one-on-one protocol. It also includes a copy of the screening survey and goal plan, but your digital download also includes a screen and goal plan, and that's where you make your copies from. You make copies from your digital download. So because you really are not supposed to make any copies from the manual. As you can see, it actually has a water print there. You know, do not copy because it's copyrighted. So, excuse me, I got a bit of a frog this morning. So section 4 is the optional protocol or script to provide it in a group setting or where you have multiple youth. We will talk about section 5, your evaluation materials. And then there are some optional resources on the website. There's a page there, but I'll take you to our website where we have the more up-to-date web-based resources that you can use as well to just enhance or extend this program, or just for your own education and benefit as a professional. But there's resources for youth, and there's resources for you, and there's resources for parents on our website, which I'll show you. So that's the table of contents. And so we're going to go through that here in just a moment. So I'm going to tell you one other thing. There's actually a real good resource on our website. You can actually access a 1-hour recorded session on the core knowledge about Prevention Plus Wellness. So it's a recorded video. We include that as a part of our training. We included 2 hours online training, the 1-hour core knowledge. But even if you don't, get the 2-hour live training, everyone can access the 1-hour recorded core knowledge. So if you're interested in these programs, these Prevention Plus Wellness programs, I'll show you where that is. So let's go ahead and take a look at, again, we're looking at, just so that you know, this is the Vaping Prevention Plus Wellness program. This is the high school version. This is e-cigarette Prevention Plus Wellness. It's an adaptation or modification of the evidence-based sport program. And remember, it's also a evidence-based practice because it is a screening and brief intervention. So there's introduction, there's steps for implementation, and then you come to the individual script. So the beauty of the script is that it doesn't matter if I implement it today or next week or next year. It doesn't matter if I implement it or you implement it. It doesn't matter if we implement it in a school or Boys and Girls Club or after school or sports or recreation, or it doesn't matter. If we follow the script, there will be a certain level of fidelity and replicability and reliability of the program implementation. So that's the beauty of it. If there is a downside, it's that the script requires a little bit of practice, 3-4 times, because it is a script. You have to get a little used to it. And then once you practice it, it's brief, it becomes second nature, and it's a very easy process. So there's advantages to the script versus just like say an open-ended counseling approach like motivational interviewing, for example. So here is the individual one-on-one script. So let's say you're sitting down with an individual youth. Now, these programs are being provided, and because they were designed to be provided as universal prevention interventions. That means for all young people. However, we do have some research findings showing that the Sport Prevention Plus Wellness program actually had larger effect sizes for youth already using substances. So what we see across the nation is that different professionals and organizations are using these Prevention Plus Wellness programs as selective or indicated interventions. So for example, you have some youth that may be screened as having, or identified as having been vaping on school. And so you can provide this individual motivational intervention for them individually. So it doesn't have to go, it can go to everyone, it can go to certain high risk groups, whether those be defined any way you want, as having been found as having using substances or disruptive or behavioral problems or in sports or whatever the case may be. These can be provided to any youth in any setting. So so you have your script. You literally read the script, you follow the script, and if you practice it, then you can really focus on good communication skills, good eye contact, and for your individual youth or your group, and that's why practice ends up being important. And then you show your slides so that you have for the visual learner, and then also reinforcing what you're saying. So when you provide this one-on-one, you have to think about how I'm going to show my slide to that individual youth. Am I going to show it on the screen? Am I going to have it on a tablet or laptop? You could even make copies of the slides and make a flip chart if you don't have access to any device to show the slides. So lots of flexibility, lots of options. So there's an introduction. Notice the introduction is a little tailored. You identify the youth, you identify who you are. After the introduction, you're going to say, hey, now is time to take the screening, the health and fitness screening survey. And so just to stop here to say there's 3 steps to Prevention Plus Wellness programs. The first step is to have young people, to ask young people to complete a screening survey. This gets them thinking about, hey, where am I at with my current health habits now? Not just vaping, for example, or marijuana or an alcohol, depending on which program you're using, but also where am I with regard to physical activity, particularly regular physical activity, eating breakfast or nutrition, sleep, and so forth. So that's what the screening survey is about. You're getting them to think about that process. The second step in this 3-step intervention is you then provide feedback about those health habits. And the feedback uses vivid terms like being fit and active and successful, those future desired images you're trying to cue or trigger that young people generally have in their minds. And so unconsciously, you're bringing those up, and that increases motivation for change. In other words, they see themselves as being more fit and active, successful. Those are desirable images or future selves. Those are values in their lives, and that increases their motivation to make a commitment to change. And that's the third step, where you ask them to complete a goal, plan, and contract. And this is where they start the behavioral change process. So not just to avoid substance use, but also to improve one or more protective wellness habits. So that's the 3 steps: screening, feedback, goal setting, and it's all done in one setting, one time period, about 45 minutes or so in length. You could fit it in anywhere. And we do show you how to extend that to more sessions and more follow-up if you need it, if you have access to you. But you don't need to. Research shows strong effect sizes 3 months, some effects even a year later from that single intervention. So you ask them to complete their screening survey. Let's take a look at the screening survey just so you get introduced to it. So the first question is, what sports physical activities did you play last year? There's a long list: baseball, softball, basketball, riding a bike. So all kinds of things, including down to S, where they could identify other, maybe some regional sports physical activities, also any kind of chore they might do, anything physical, cleaning a house, mowing the yard, working outside. And then, of course, the very unlikely response, T, that they didn't do any sports or physical activities last year. That's the first question. So that's a long list that they could check off from. That's question one. Question two is, do you participate in any physical activities for at least 30 minutes, 4 or 5 times a week? For example, riding a bike, running, walking, swimming, playing a sport for 30 minutes or more most days, yes or no. So you'll notice here, these are the same questions as on the sport program. So and then I'll highlight the difference between sport and the vaping and the marijuana program here in just a minute. The third question is, do your friends influence you to participate in regular physical activity? Yes or no? That's a social, environmental question. Question 4, do you usually eat a healthy breakfast each morning? For example, cereal, low-fat milk, whole wheat toast, oatmeal, eggs, fruit, yogurt. So, by the way, just to highlight, again, young people are at risk for e-cigarettes as well as alcohol, marijuana, other substances. But actually, they're at greater risk for these chronic disease risk factors. The majority of youth are not getting a full hour of physical activity every day, which is the recommended amount. The majority are not eating a healthy breakfast every day. The majority are not, they're not even eating 3 or more fruits and vegetables a day. The majority of youth are not getting 8 hours of sleep each night, when in fact some of them may even need 9 or 10 hours of sleep. So these are all critical chronic disease risk factors that are also associated with substance use. They interact with substance use. So that's why this is an integrated, more of a holistic strategy, a youth developmental kind of an approach to prevention. And if you provide this program within a context where you have other opportunities for them to get physical activity or sports, or you provide opportunities to eat healthy, you provide other education about nutrition or sleep, this works really well. So this program is more often than not, Prevention Plus Wellness programs, more often than not, used in conjunction with other prevention and intervention and fitness and health and education programs. And the difference between Prevention Plus Wellness programs, whether it be vaping or marijuana or sport or in shape or what have you, is it's largely motivational. It's designed to motivate and to initiate behavior change. And it does that very well. And it does it very cost effectively. And so it's more of a motivational strategy than it is an educational strategy. Although young people do learn, or are at least reminded of, the interaction between substance use risk behaviors and protective wellness behaviors. Okay, and then where did I leave off? Breakfast, and then number 5, do you usually sleep 8 or more hours each night? Yes, no. And then question number 6, last question is, have you ever used an electronic or e-cigarette, for example, the Juul, e-cig, e-hookah, hookah pen, vape? So that question comes right out of, I think, CDC, so it's a common question. And the answer is yes or no. So that's it, just a couple of minutes to complete that 6-item survey. And then beyond that, if you want, there is this optional, what we call a screening survey addenda, which is really a pre-test. And then we have a post-test, which is called a feedback survey, with these same items. So if you wanted to do an immediate pre-post on your lesson, you have that option. And this pre-test is a scannable form. We also have it online if your youth could fill it out online, even better. But you've got the scannable form. If you collect it from your kids, the pre-test and the post-test, you scan it, You send it to us in a PDF, and we have the software, and we'll run a free analysis for you. So we discuss more of that during the training. But you can't measure behavior, obviously, within a 1 hour period, a 1 session period. So we measure the best indicators and predictors of the health behavior. So what we have here, the first item that we're measuring is behavioral intentions. It's according to science, the most highly predictive measure of future behavior. And the question is, in the next year, how likely are you to? Answered on a 4-point scale of not at all to very. And notice we're measuring healthy habits, wellness habits like physical activity most days a week, getting 8 or more hours of sleep, but also a range of substance use, not just e-cigarettes, but alcohol, cigarettes, marijuana. I thought there was also another one. Oh, there should be another one, other illegal drugs. So anyway, a number of behaviors. So you'll be able to determine, if you collect this, determine whether your lesson that you presented increased intentions to engage in the wellness behaviors and decreased intentions to use the risky substance use. A second item is a social norm, very predictive and influential of health of behaviors. And I know this. For some reason, I've got an older version of the manual I'm showing you right now. So, but anyway, this should be people your age. How many people your age from a 4-point scale of none to all. And this really is only going to be measuring 5 items: alcohol, e-cigarettes, tobacco, marijuana, and illegal drugs. The next item, see these are a little old, will be the third item will be this one. If you used any of these substances regularly, would they harm your health or healthy habits? This is a measure of perceived harm or risk, scored on a 4-point scale of yes to no. And again, you're measuring 5 substances. And then there's also a self-efficacy to avoid a substance use. So you have 4 measures, and that's at a pre-test and post-test. That's optional. But everybody should be able to and should get the screening survey. That's the 6 items. And then now you're going to provide feedback to them on those 6 items. So how does that work? Well, you have your individual script and you follow along. And after the youth has completed their 6-item screening survey, you take it, ask them to give it to you, you glance down, you see how they answered the first item about whether they engage in any physical activity or sports in the last year. And if they said yes and they checked off some of those items, you read the yes response. Yes, as in go, good, positive. That's yes to getting physical activity. If they checked no, they didn't get any physical activity all year, that's a red response. That's a no. That's a higher risk or stop or warning. So what are the difference between the yes and the no? Well, the yes response says, as you can see here, you show a slide and you read the script. I see that you participate in, and you could read off some of the sports that they checked off, whether it be biking or rollerblading or soccer. And so you're recognizing what they did with regard to that wellness behavior. If they checked off no, then the response is, I see you do not play sports or physical activities, any physical activities. You could really improve your health or how well you feel by being more active. So it's just tailor or customized to where they're at with their physical activity. Other than that, the messages are pretty much the same. It's a 2-step messaging process. The first step, and it's shown by the first slide, is where you highlight and cue these positive images and other benefits of that wellness behavior. And the wellness behavior here is sports, physical activity in the last year. You show lots of those positive image terms. You also show images and illustrations of young people engage in these activities that they could relate to, so that they can see a representation of themselves. That's why we have we show both genders, we show different ethnicities, different activities. And so the first slide and the script highlights the benefits of sports physical activity in the last year. The second slide highlights particularly how e-cigarettes interfere with sports and physical activity. Now, the difference between this and marijuana prevention plus wellness is that this feedback is the same, benefits of sports physical activity, but this slide is different. So for vaping, you're going to have how e-cigarettes interferes with sports and physical activity last year. The original evidence-based sport focuses largely on how alcohol interferes with sports and physical activities last year. Marijuana prevention plus wellness will largely address how cannabis interferes with sports and physical activity last year. So that's the difference between the adaptations of the sport program, whether they be original sport prevention plus wellness, or vaping, the adaptation of vaping PPW, marijuana PPW, opioid PPW. And so, then pretty much the same slide, pretty much the same content if they answered no, and then you go on to the next item. Again, you're providing this feedback to the youth individually. You're showing the slides or the flip chart. If they answered yes to the second screening question, that they get regular physical activity, you read the yes response, you show the first slide, and you're again triggering those positive images, positive benefits of regular sports and physical activity. I see you engage in regular physical activity. That's great. You're even asking them a question: what types of sports or other physical activities do you like or want to do more of? So you're getting them to think about, reflect upon their own habits. However, e-cigarettes interfere with being regularly physically active. And then they may have checked, no, they don't get regular physical activity. So you'd read this response instead. I see you do not get regular physical activity to feel better and to have a healthy heart and fit body. You should get some physical activity. But nonetheless, you still have the same slide. You still then cue these positive images and benefits of regular physical activity and show how e-cigarettes interfere with that, and so forth. And you go on to feedback about physical activity norms. If they answered yes to having friends that support the physical activity, you read the yes response. If it's no, you read the no response. Same with breakfast and nutrition. They get regular breakfast, you read the yes breakfast response. And by the way, that sort of broadens. There's more content here. It's not just about breakfast, it's also about fruits and vegetables and other nutrition. So you read the yes response, you read the no response. Same with sleep, yes response, no response. And then when you get to e-cigarette, there's more content. There's more content because we're addressing more risks like we did in the sport program for alcohol. Same thing here for the vaping prevention plus wellness program. You're going to address how e-cigarettes can harm your fitness and health, how e-cigarettes can cause life problems, that there's common misconceptions that you're going to address about e-cigarettes, that most youth do not use e-cigarettes. That's a social norm messaging, that there are healthy alternatives to vaping. And then we want them to choose for themselves to avoid e-cigarettes now, to plan ahead at this point. And then there's a summary about all the risks associated with e-cigarettes. So this is tailored to the individual. If they didn't use e-cigarettes, you'll read the yes, the no e-cigarette, that's the positive, that's the green. If they did say they use e-cigarettes in the left, I think it's ever. You read the no response. That's the feedback to the youth. And then after that, you go immediately into the goal plan. So you've asked them to fill out a screening survey, you've provided feedback, and now they're motivated to change. And now you're going to capitalize on that by asking them to fill out a goal plan. You'll walk them through the goal plan. There's a number of sections to it. You're going to recommend that all of these healthy behaviors, 8 or more hours of sleep, healthy breakfast, healthy foods, regular physical activity. Also, avoid all e-cigarettes, but also tobacco, alcohol, marijuana, etc. Then you're going to ask them to make a pledge to avoid e-cigarettes, tobacco, alcohol, drugs, and to identify one or more protective wellness behaviors. Specifically, it's going to be a measurable behavior, and then you're going to identify the amount and the frequency. Then they sign and date, and you co-sign and date, making this a contract and increasing significantly the motivational force of this document. There's some wellness tips. There's some very important concluding statements about posting it, tracking, monitoring their behaviors after that. So that's the intervention done in the single setting, screening, feedback, goal setting, 45 minutes or so. There's also an optional group script. So if you wanted to provide this to a group of young people rather than an individual youth, you could. Same slides. You show your slide, you have an introduction, you have them complete a goal setting, and then you provide feedback, and the feedback is a little bit more generic. So everybody's getting the same feedback with regard to like regular physical activity. There's an assumption there that most people are getting it. You're going to be more positive, you're going to be supporting it, but you're also going to be asking them to think about their own behaviors. So a little less tailored, nonetheless. Even the group session, they do complete their own goals, their own screening survey, so they're thinking about their own habits, and they do their own goal setting, so they are tailoring their goals to their own particular needs and desires. So there's this script to provide feedback in a group setting, and at the end of the feedback, there's going to be, again, the goal and contract. There's also an additional, if you wanted to have a second group session, there's this group interactive exercise. That takes us into section 5. There's some evaluation materials. The first item is a feedback survey. That's the post-test. Notice the same items on the pre-test or the screening survey addenda are in the post-test. So you'll be able to measure from pre to post during that lesson whether you've changed their intentions to engage in the healthy behaviors and to less intentions to avoid substance use, whether their overestimation of the number of their friends that are using substances are reduced, whether their perceived risk for using vaping and other substances are increased, and whether they whether their skills or perceived confidence in avoiding these substances are increased. So those are the 4 measures. We have it on a scannable form. We also have a reduced size form that just has measures of 2 items instead of 4, behavioral intentions and perceived risk or harm. And so that you could spend less time actually collecting the pre-post data. That could be a plus for some settings. But the post-test also includes 2 open-ended items. One is, what did they like best about the lesson? What did they like least? What did they like best? You could literally cut and paste comments from students and use those to promote the program to other students, to parents, to community, to funding agencies. That's marketing and promotional material will come from that. You'll get some really good feedback, and I think feel good about the impact you're having on youth as they describe it in their own words. And then items 7 and 8, I guess. Item 8 is what do they like least, and that will give you some hints as to how you can improve your program over time. Remember, if you scan the pre and post test in any printer scanner and send us a document, we will run a free analysis, and we have directions for doing that on our website, and we discuss it in our live online training. We also have an instructor survey. It's a process survey to complete after implementing every lesson, and we also have a fidelity checklist. And now let's take a look at, well, before we take a look at the resources, let's take a look at a PowerPoint slide. Let's take a look at what does it look like too. Let me switch out, actually. I'll switch out the vaping with the marijuana, just so they could see, compare and contrast the differences. But I'm going to pull up the some slides, PowerPoint slides, so you can take a look at what we've got here. So if you'll just give me a moment, allow me to find the slides. Let's see here. Okay, so this is actually a copy of the middle school marijuana prevention plus wellness slides. So let me just grab onto that slide and I'll show it to you. So here it is. Here's the slide. There's the introductory slide, the first slide. And then as you notice, if you implement this in a group setting, this can help you. This can help you because you have the directions for the health and fitness screening survey, and then you have the survey items on a slide, so you can move your group along and keep them together and move things more efficiently, I think. So that's why we included it. If you don't want to use this, you can, or if you're implementing this to an individual youth, you could skip these items. But notice that all 5 items are included, including the last item. Did they ever use any marijuana? And notice that this is for the marijuana program. So for example, smoked or vaped marijuana, or ate any food with marijuana in it, or drank any beverage with marijuana in it, yes or no. So this is the middle school version slides for the marijuana prevention plus wellness program. After that, immediately come the addenda or pre-test items. And so you could highlight, if you're going to use this, you could highlight that they complete these carefully, stay within the bubble because you're going to scan them. And the measures are behavioral intentions, social norms, perceived risk or harm, and avoidance self-efficacy. And then after that, you go into your slides. The first slide will be similar. It'll be highlighting the benefits of physical activity in sports in the last year. But the second slide, depending on which program, will be different. In this case, it's marijuana, and is highlighting how marijuana and physical activity don't mix. In this case, because marijuana can hurt your brain and lungs, and how well you do in school and sports. So the content differs whether it's a vaping prevention plus wellness, marijuana prevention plus wellness, sport prevention plus wellness, opioid prevention plus wellness, in God's image, which is a faith-based program. So that's the difference, and now you know. And then at the end of all of your program slides, it'll remind you complete the goal plan. You can walk your participant or participants through the goal plan. And then if you want to collect the feedback survey, which is the post-test, you can walk them through the directions and those 4 items again, as well as reminding them to complete the, what did they like best and what did they like least about the lesson. So there you have it. That is it gives you a sense of the difference between vaping and marijuana prevention plus wellness programs. The difference between the high school, middle school is really, there's not a lot of differences. There are some, they're subtle, but of course the images are very important. So you got older high school, high school age youth being illustrated. In middle school, you've got a little bit younger adolescents being highlighted in those illustrations. Okay, so now I want to just show you a little bit about the resources, the web-based resources and other resources that we have on our website. So let me pull up our website, and then I'll share that with you right now. Our website is preventionpluswellness.com. I highly recommend everybody go to it. Type in, you'll see a pop-up, type in your email so that you get a weekly email blast and stay in contact with us. This is our home page. You can learn more about our programs, our training programs, story and mission, success stories, what youth are saying about sport, and so on. There's a lot of good stuff here. So But also, if you point your cursor at programs, you could see our whole list of programs. You could see request a sample. If you want a sample of our programs, you just go to this right here, or you could just email me. Down in the lower right corner, it says message us. You could just click on that and say, love to have a copy, a sample of the vaping for high school. And we'll send you a redacted electronic version of it. So feel free to ask for any samples of any of our programs, or most of them if you really want to take a look at them. Also under programs, you'll see the order form if you want to see a PDF of an order form. But all of our programs are here. Now, just to highlight what's going on because of the changes with our current coronavirus pandemic, we're trying to provide some alternatives to provide our programs through distance, instead of just face-to-face. So yes, you could still present our programs by phone. You can present them live online, but we're also now created some videos of our programs. So if you want to send a link to students, we also have down on the bottom here, we've got Sport and In Shape. We presently only have Sport and In Shape in a booklet format, but if you wanted to order some vaping prevention plus wellness or marijuana prevention plus wellness in a booklet format and wanted to pre-order, I would create that for you. So let us know what you need from us. And remember, tomorrow, actually, Friday, same time, we'll be having a free webinar on how to provide prevention and specifically prevention plus wellness programs online and by distance. So you can point your cursor at training and learn about our online and on-site training, youth leadership training. We train youth, or we could train you as a trainer, and you could train youth to provide these programs to other youth. A great experience. You could host a training workshop in your area. Of course, unlikely to do that now until the virus dies down. Program a training schedule for online training, and program and training licenses. That's where we try to get, the state or some large organization to, purchase a license so that the programs and training can be more widely translated or disseminated throughout a region or throughout a state. Then let me just move my picture here. Then there's our news items. We put news items on throughout the week. Take a look at them. There's, free webinars and announcing research and all different kinds of things. So good stuff under the news. Now, the core item I wanted to show you was more, M-O-R-E. That's where you can get some extra material. So I'll let you look at this on your own. But if you go to the bottom of the more, that's where you get the last item on the menu is called PPW Youth and Trainer Resources. Let me just show you this very quickly. There's an introduction, and then there's the 1-hour core knowledge training. There it is. You just click on that YouTube link and get that additional training. But then we have web-based resources, and because Prevention Plus Wellness is about promoting wellness as well as preventing substance use, we've got these web-based resources for youth and web-based resources for professionals like yourselves and parents. So for youth, and by the way, they're broken out into all of the behavioral areas that our programs address: physical activity, nutrition, sleep, stress control, goal setting, spirituality, as well as 2 risk behaviors, which I think are relevant, particularly today: e-cigarettes and marijuana. So I'll show you these. So for example, under youth physical activity resources, the first item is Youth Physical Activity Guidelines, CDC Healthy Schools. There's a description, there's a link to it, and there's a homework assignment. So you could feel free to use these, send these out, use them. I think we'll cut some short videos and send them out to those that are on our email list, so that you could share those with your, make it even easier to share those with your adolescents. So physical activity resources for youth, Then there's physical activity resources for professionals and parents. And there's a description and a link. And some of these resources for the kids are blogs and their games and their videos. Most of the stuff for the parents and the youth is content, written content. You can go down through all of this: nutrition, sleep, stress control, goal setting, spirituality, and then you'll get to, as I said, the 2 risk areas. Where are we? Goal setting, spirituality. If you're in a faith-based setting, there's e-cigarettes. So you've got e-cigarette resources for youth, e-cigarette, and there's not a whole bunch of them, by the way, in this area. And then there's e-cigarette resources for teachers and parents, and then the same for marijuana. So go ahead, explore this. It's free, all good stuff for you under the heading of more. There's also other resources here to promote your prevention plus wellness program, free evaluation services, all kinds of free grant proposal, lots and lots of good stuff there. All right, I'm going to stop at this point. I've been yakking away. And so what do you think? Any questions, any comments, any suggestions? I'm open to hearing from you. At this point, just type it in your chat note area. I'll see if anybody had anything while we were talking. We had some people join us then from another, I don't know how to pronounce that, from New York. Sounds like an interesting player. Is Mima. Oh, I'm sorry, that's a person's name. I apologize. That's Yamima from New York. I am so sorry about that. Forgive me for my ignorance. Let's see, is one available for sample as well? So I think I'd be happy to send you any. What we have is our redacted samples, e-samples. So if you just request whatever you want, and we'll send you one, you can take a look at it, review it. Do you offer TOT for these evidence-based programs? Yes, for evidence-based, evidence-informed programs. So here's the procedure. That's a great question. So you can get training either online or on site, and then you can get TOT training. So because of the epidemic, the natural thing is to talk about the online training. You get trained as a provider, 2 hours live. You implement that program one time, and then you're eligible for the 2-hour TOT training. So that's how you become a train-the-trainer. And that's how you're able to then turn around and train other providers or even other youth to provide, whether it be vaping prevention plus wellness, marijuana prevention plus wellness. The train-the-trainer online cost, I think, is $349 a person per program. I hope that answers your question. Do you offer TOT? Yes, I answered that. I'd like to see more about God's image. So just request a sample. God's image is, we really, really want to get that out. That's for, that's just a $99 program. It's a digital download. You copy it and you're ready to go. And you can implement it to countless youth. And the protocol or the script is just for a group setting. So we really want to try to get that out because, faith-based settings, particularly Christian faith-based settings, have asked us to, they said we like sport, we like these other programs. We'd love to have something that's a little bit more faith-based. So we developed in God's image. So it addresses avoiding substance use, improving healthy habits, but also improving spiritual practices and attitudes. So that's what In God's Image is all about. And you can look at it and learn more on our website. Just click on under the programs In God's Image. You can read about it. And if you want, you can request a sample of it. That's In God's Image. Thank you for information. You're welcome. I'll follow up. I'll send everybody. There's still more questions, so if you got to go, but I'll still stay with anybody who wants to stay here. I'll send everybody a follow-up email a link to this recorded session, which I hope you'll share, and then a certificate for 1 hour CEU. What are the actual ages, since our grant is for 9 to 20 age? So it depends on which program you're talking about. And I asked about TOT training, Pam from New York. So we've got, for example, for sport, we've got high school, middle school, elementary school, in shape prevention. So high school, let me also say marijuana and vaping, high school, middle school, opioid, adolescents. So high school is for the high school age, 14 to 18, middle school, usually what, 10 to 14, elementary is below that. We have in shape prevention plus wellness for the 18 to 25, 26-year-olds. So you can literally provide prevention plus wellness programs from children all the way through young adults using our programs. And In Shape is the program for young adults. We also have Sport 2, which is 6 lessons, and that is high school, middle school, and elementary school. So those are the ages, those are the programs that we provide. I hope I didn't miss anybody's questions. Great questions, great comments. Let me know, request any samples you want to see. I'm happy to send them. I think that's it, and I think we're out of time. So again, I want to thank you and bless you for all you do to make a difference in the lives, protecting the health and well-being of young people, families in your communities. Thanks for tuning in, and please join us for tomorrow's webinar. And stay tuned. Do plug in your email, because we will be sending out some videos and some things that you can use for distance learning coming up here. So, and if you need anything else from us, if you want or need anything for us to develop for you, please let me know what that might be, and we'll do everything in our power to go ahead and create that for you. Thank you. God bless you for what you do. Have a great afternoon. Stay safe, and I hope to be in communication with some of you in the future. Bye, everybody. Thanks for joining.